Good morning. My name is Deidre Carter, and today we're going to talk about my intervention feedback from my capstone video. The meeting date, the meeting occurred between Wednesday, Thursday, and Friday. The length of the meeting, each meeting lasted approximately 3 hours or more. And the location of the meetings were held at my house. The meeting was held in my house because my sister stayed with me because I'm trying to get her help. So I just feel like she'll be safer if she stay with me and we can kind of get the ball rolling. Describe the problem you were addressing. The problem addressed was family health concerning substance abuse and mental health disorders, specifically focused on my sister drinking problem. Why was the problem for the patient? Why was this a problem for the patient, family, or group? This issue was significant because my sister's drinking problem was impacting her well-being and creating stress within our family. She needed structured support to address her addiction and associated mental health challenges. What was your intervention? The intervention involved providing information on the signs and symptoms of substance abuse, locating support groups, and offering personal support to my sister. I also provided her with a brochure containing steps for seeking help. How will the patient, family, or group apply the intervention? My sister will use the intervention by following the steps outlined in the brochure, including attending support groups and utilizing community services or resources. How often will the intervention be used and under what circumstances? The intervention will be applied every other week or as needed, particularly when my sister seeks additional help or support. How easy was it for the patient, the family, or group to use the intervention? Implementing the intervention was challenging. Despite having all necessary resources, my sister struggled to adhere to the recommended steps and often resisted seeking help. She starts off doing real good, and by me being her big sister or whatever, she's only me and her, and I'm the oldest sister, and she listens to me and she listens well. But I think when we take it a step further, like trying to get resources or groups or something that she can participate in, I think that's when she kind of goes left. Like she don't do good when she's in a group around other people. So we are working on that. Describe any challenges associated with the patient, family, or group used for the intervention. The primary challenge was encouraging my sister to engage with external resources and community support, as she was reluctant to seek additional help beyond what was provided. And that's what I was talking about. Like, she's okay with me talking to her, giving her tips on things, just going over the brochure with her and stuff. She's okay with the resources and the extra support when I'm reading it to her. But when it's time to actually just get out there and get the extra support or the resources, then we have a problem. Were instructions necessary? Yes, detailed instructions was necessary to guide my sister through the intervention process effectively. What did the patient, family, or group say about using the intervention? My sister appreciated the intervention but struggled with following some aspects of the treatment plan, indicating a need for a consistent support and motivation. She liked the treatment plan. She struggled with that a little bit as well. Due to my sister drinking, it has caused her high blood pressure. So she goes to the doctor like she's supposed to, but she now has high blood pressure. And because of the treatment plan that the doctor has her on for the high blood pressure, she's struggling with it. It's like 1 minute she's okay with it, And it's like the next minute, like, I want to have a drink. So, no, I'm not going to take this blood pressure pill because I know I can't take it and drink. So, I'm going to have a drink. So, we struggling with that part. Like I said, it comes and goes. She's okay sometimes. And then sometimes, like, I need a drink and I'm going to drink. And so, she won't take her medicine. Was the intervention helpful? Overall, the intervention was helpful. It provided my sister with crucial information and support. Yeah, for the most part, it's helpful. I mean, it really is helpful. I mean, she just comes and goes with it, but it's very helpful. And she understands. She understands it, and she know that, her sister wouldn't tell her anything wrong. So, how will the patient, the family, or the group continue to use the intervention? To continue using the intervention, my sister must remain committed to the treatment plan. Of course, when she feel like having a drink, not to drink, and continue taking her medicine and doing the resources and everything as needed. Regularly attend the supporting meeting, which we're working on that because she's not a fan of being around a lot of people, and utilize the provided resources. Explain how the intervention positively or negatively affected the patient, family, or the group's life. Intervention positively impacted my sister by increasing her awareness of the signs and symptoms of substance abuse, thereby helping her understand her condition better and providing a path to seek help. I really made a big deal of the signs and symptoms because some people don't know the signs and symptoms. I mean, this is normal for them. She thinks these things that she's doing is normal, but when someone else pointed out to her, like, you think it's normal, but it's not normal. So she really thought that the signs and symptoms was normal until I made my brochure and broke everything down to her. How can the effects be measured? The effects can be measured by tracking my sister's attendance to the support groups, which she stays with me, so I'll be taking her wherever she needs to go, so that'll be easy for me to track. Monitoring the treatment plan. She stays with me. That'll be easy too, but trying to keep on track with it, I don't know, but we're working on it. And assessing any improvements in her substance use with mental health and over time. Regular check-ins and feedback from support groups can also help evaluate the effectiveness of the intervention. I want her to go out and be around other people and get, just listen to other people's stories and stuff like that. But right now, my main focus is family. So me and my family, we get together and we her support group. We listen and everyone's talk and we engage and, just get an understanding of everything. And then I feel like that'll make her more comfortable when she do, go to support groups and stuff like that. I mean, she'll feel a little bit better because, being around us maybe will help the situation. So, we on to another topic. When I think back on my practice, I'm appreciative of the deep learning opportunities it offered. My practical abilities were much improved by applying my academic knowledge in real-world circumstances through direct interaction with patients and healthcare professionals. Working in a variety of environments expanded my knowledge of patient care and gave me more self-assurance in my clinical skills. A key component of my RN to BSN journey was my Capstone project, which was centered on my family health with a focus on substance misuse and mental health concerns. My understanding of these important topics has increased as a result of these assessments, which has also improved my research and inquiring ability through investigating the relationship between mental health and family dynamics. I created thought methods of patient care that takes into account the viewpoints of the patient as well as the family. The research made clear how important an integrated care approach is, and it got me thinking about creative ways to deal with mental health and drug misuse in families and systems. Throughout the RN to the BSN program, I experienced significant personal and professional growth. Academically, I advanced my understanding of advanced nursing concept and evidence-based practice, which equipped me to deliver high-quality care. Professionally, I enhanced my leadership, communication and critical thinking skill, which are essential for effective nursing practice. Personally, the program challenged me to balance careful coursework with clinical responsibilities, fostering flexibility and adaptability. Thank you so much and have a good day. Thank you so much, Dr. Sabrina Pope, for helping me through this process. God bless.